disease may score a direct hit on one member of a family, but shrapnel tears the flesh of the others, there is no doubt that my children and my husband were really hurt by my diagnosis. I remember one time my littlest daughter, she said to me, I was bald, and she said, Mommy, she's 3 years old, Mommy, you don't look pretty anymore. And that was her way of saying, something's really wrong here. There's just something really wrong. I mean, I know my mom said she had cancer, but I don't get it. She doesn't look the same. She's not acting the same. Something's really wrong with my mom. When I told my mom, who lives in California, that I had cancer, I set it up with my brother and my sister to be there by her because they lived nearby. And I called my mom, and I was trying to set it up for her to, instead of just blurting out, Mom, I have cancer, I was trying to set it up for her by saying, you know, Mom, there's a lot of people that survive cancer now. And so I'm sitting there trying to set it up for her, and she's trying to get me off the phone. And I'm like, Mom, don't hang up on me. Wait a second here. Don't hang up. And later I learned my brother was sitting there so sick and so ashen-faced and so despondent that all my mom could think is, there's something really wrong with my son. I need to get to him. I've got to get my daughter off the phone. My cancer must have aged my mom a dozen years. The thing that's really interesting about healing and about resilience is that the more resilient you are and the more you heal, doesn't matter what, whether it's divorce, alcoholism, serious health problem, whatever it is, the more resilient you are, the more resilient your children are. They pattern themselves after you, and research shows that. And I think of resilience and showing my kids that you can have a good life despite serious adversity is like a gift that you give them. It's like giving them a good education or trying to feed them good food. It doesn't mean that I'm always happy, that they don't see my tears, or anything like that. But to show them that you can have a good life despite adversity, that you can be resilient, and that they can be resilient is really important. My kids, as they work to heal, I went and I visited with the American Cancer Society, and they said, the book publishing division, they said, what should we be writing more about? And I said, you know what, you should stop writing about dying and you should start writing about living. Because there's almost 11 million cancer survivors in this country. And you know what, we want to hear about what it takes to survive. We want to hear about what it takes to heal. And they said, yeah, that's great, that's really interesting, all right. And they gave me a book, and the book is a children's book. It's Our Mom Has Cancer, and it's all about the diagnosis and the treatment of breast cancer. Or maybe it wasn't breast cancer, maybe it was just cancer, but I brought this book home and I showed my kids, and I said, wouldn't it be cool if you guys did a book on what it takes to survive, or like a survivor family, a survivor book. So my kids just published last week a book called Our Mom Is Getting Better. And it's the story of really our family, but it's a story of lots of families about what it takes to heal. And you'll see pictures in the book of me going to bed before my kids did, and them standing over me. You'll read about how we had to cancel our family vacation, and how I started making them eat more fruits and vegetables, and about taking family walks in the neighborhood. And the message is that resilience is really a family issue. It's really a family issue.